When men pass the age of 60, they often underestimate the importance of penile health, thinking that certain changes are simply part of natural aging. However, the reality is much more complex. Male sexual health is directly linked to overall well-being, including circulation, hormone production, and personal confidence. Maintaining the functionality of the penis not only ensures an active intimate life, but also protects overall vitality, helps prevent cardiovascular diseases, and contributes to greater longevity. General studies suggest that men who pay attention to their intimate health and adopt preventive habits tend to maintain higher energy levels and a better quality of life. Imagining everyday situations, such as the ability to sustain fulfilling sexual relations, experience pleasure without pain, or enjoy intimacy naturally, highlights the importance of this care. Ignoring it is not just a risk for sexual life, but for overall health and self-esteem. Many men notice subtle changes and dismiss them, believing they are normal due to age. However, alterations in skin color, minor discomfort, changes in sensitivity, difficulty urinating, or recurrent inflammations are clear warnings that should not be ignored. It is common for seemingly mild symptoms, such as tingling, burning during urination, or slight discharges, to appear, which over time can develop into more serious problems. Some men notice small ulcers or spots and choose not to pay attention to them, which allows diseases to progress unnoticed. Even variations in the rigidity of erections or the frequency of nighttime episodes can indicate that something is not functioning correctly, serving as early signs of vascular or hormonal issues. Recognizing these signals in time is essential to intervene effectively and prevent complications that affect both intimate life and overall health. Once early signs related to the penis are recognized, it is crucial to establish habits of monitoring and prevention. Observing daily changes such as color, shape, or firmness of erections helps identify abnormalities before they become serious problems. It is recommended to examine the penis regularly, at least once a week, ensuring there are no lumps, wounds, or abnormal discharges. Additionally, paying attention to the frequency and quality of nighttime erections allows possible vascular or hormonal issues to be detected. Maintaining a mental or even written record of these changes facilitates early detection and prevents subtle signals from being overlooked. Prevention begins with awareness and constant observation, becoming a habit as important as diet or physical exercise. Before continuing, I would love to know something to connect with our community. Which city or country are you watching from? Write it in the comments. I enjoy getting to know people who truly care about their health, and this helps me create content that is more useful and relevant for you and your region. Let's get straight to the point. Despite warnings, many men look for quick home solutions to improve penis size or performance, applying strange ointments, oils, vinegar, or improvised devices. These attempts may seem harmless at first, but the reality is that penile tissue is delicate, and any excessive pressure or inappropriate substance can cause micro-tears, scarring, and permanent loss of sensitivity. Fictional stories of men who applied rubber bands to try to lengthen it or used products promised online show how curiosity can lead to intense pain and lasting regret. Damage caused by these home practices not only affects sexual function, but can generate anxiety and fear, creating a negative cycle that impacts self-esteem and confidence in intimate life. Instead of risking penile health with home remedies, today there are safe and proven options that improve function and intimate well-being. Modern treatments include approved medical therapies that act effectively and in a controlled way on circulation, sensitivity, and erections. There are medications that help regulate blood pressure and erectile response, as well as non-invasive devices that strengthen tissue without causing harm. Consulting reliable sources and specialized professionals ensures that any intervention adapts to the body's needs without putting its integrity at risk. Furthermore, advances in research offer less aggressive and more effective solutions, allowing sexual function to be maintained naturally and safely over time. Penile hygiene is a basic aspect that is often overlooked, especially in older men. Properly cleaning the area every day prevents inflammation, bad odors, and more serious problems like recurring infections. Uncircumcised men need to gently retract the foreskin to clean the head of the penis, removing accumulated secretions that could become a breeding ground for bacteria. Using mild, neutral soaps is key, as perfumed or harsh products can irritate sensitive skin and cause small injuries. Even a simple daily habit, like rinsing with warm water and thoroughly drying the area, prevents complications that could require invasive treatments and ensures comfort and continuous well-being. Proper hygiene not only prevents immediate discomfort, but also protects against infections that can complicate intimate life. Common infections such as balanitis, irritation from fungi or bacteria, and inflammation of the foreskin are direct results of inadequate cleaning. Keeping the area dry, avoiding harsh products, and carefully cleaning under the foreskin ensures a healthy environment and reduces the risk of chronic inflammation. Additionally, wearing cotton underwear, changing it daily, and keeping the area ventilated helps prevent moisture and bacteria accumulation. Prevention requires consistency, and simple daily care can mean years of sexual comfort and peace, avoiding painful treatments or unexpected complications. Some men notice small discomforts, spots, wounds, or bleeding and choose to ignore them, thinking they will disappear on their own. However, these symptoms may be signs of problems that worsen over time, including deep infections, vascular alterations, or even early tumors. Seemingly mild conditions such as burning during urination, small ulcers that do not heal, or intermittent pain during erections can evolve into more serious conditions if postponed. Recognizing these signs and paying attention to them is essential to prevent a problem that started as minor from becoming a complex situation affecting sexual function and quality of life. Constant vigilance and immediate action at any change protect intimate health and maintain overall vitality of the body. When you notice any sign of pain, bleeding, or wounds, acting quickly can make the difference between a minor problem and a serious complication. Timely intervention allows many conditions to be resolved with simple, non-invasive treatments, avoiding complicated surgeries or permanent damage. Detecting early changes in the skin, texture, or sensitivity of the penis is an act of responsibility toward your own body. Ignoring these signals can lead to irreversible situations that affect both sexual function and personal confidence, so maintaining constant attention to any anomaly is essential to preserve health and vitality. Active prevention does not mean constant worry, but conscious observation. Knowing your own body, identifying what is normal and what is not, and reacting to any change allows for a healthy sexual life without unexpected interruptions. Every small discomfort that is addressed in time becomes an opportunity to maintain well-being and prevent future complications. This proactive approach ensures that penile tissues remain functional, blood flow is adequate, and elasticity is preserved, protecting intimacy and overall quality of life. After 60, some men tend to underestimate the risks of unprotected sexual activity, believing that certain diseases no longer affect them. However, sexually transmitted infections remain a threat, and often their symptoms are silent until the disease is advanced. Lack of caution can bring serious consequences, such as tissue damage, chronic complications, or infections that are difficult to treat. In addition, the intensity of sexual activity can cause physical injuries, especially when risky positions are adopted or control is lost during arousal, increasing the likelihood of penile fractures or trauma that require urgent attention. Maintaining protection during sexual activity is not an act of fear, but an act of care and responsibility toward your own health and that of your partner. Using condoms, understanding your own anatomy and bodily limits, and being aware of the intensity of the act are strategies that prevent risks and ensure that pleasure does not become a problem. Practicing safe sex protects erectile function, tissue integrity, and the peace of mind to enjoy intimacy without concerns, fostering an active and healthy sexual life in the years after 60. Ensuring safety during sex does not mean limiting pleasure, but enhancing it consciously. Choosing positions that reduce pressure on the penis and tissues, as well as using appropriate lubricants, helps prevent tears and microtraumas that could lead to painful scarring. Controlling the intensity of the encounter and taking the necessary time to understand your own reactions avoids accidents and ensures that every sexual experience is satisfying and free of unnecessary risks. Attention to safety turns sex into an act of care for yourself and your partner, promoting confidence and enjoyment. Consciously planning sexual activity also includes knowing the anatomy, respecting the body's limits, and recognizing signs of fatigue or discomfort. The combination of protection, communication, and body care ensures that sexual activity remains safe and pleasurable in the long term. Maintaining these habits ensures that the penis stays healthy, tissues function properly, and sexual life continues actively for many years, without unpleasant surprises that could affect both health and self-esteem. The testicles require a lower temperature than the rest of the body to produce quality sperm and maintain proper hormonal balance. Constant exposure to excessive heat, such as prolonged sitting in hot tubs, frequent sauna use, placing a laptop on the lap, or wearing overly tight clothing, disrupts this balance and reduces fertility. In addition, heat exposure can generate fatigue, discouragement, and a general decrease in vital energy as the body responds to thermal stress by reducing essential hormone production needed for well-being. Over time, the combination of constant heat and careless daily habits can slowly damage testicular function and affect sperm production. The consequences are not always immediate, but accumulate silently, weakening vitality and intimate health. Understanding how the testicles function and respecting their need for controlled temperature is key to preventing long-term problems, maintaining fertility, and ensuring that the hormonal system continues to operate efficiently in the years after 60. Protecting the testicles from heat exposure is fundamental for maintaining optimal function and preserving fertility. Wearing loose underwear and pants allows the genital area to remain ventilated and cool, preventing heat accumulation that can affect sperm production. Placing the laptop on a table instead of the lap and limiting time in saunas or hot tubs helps maintain the proper temperature. In addition, taking breaks and changing positions during sedentary activities helps ensure efficient blood circulation, avoiding fatigue and negative effects on hormone levels. Adopting these simple measures in the daily routine has a direct impact on intimate health and overall well-being. When the testicles feel protected and in optimal temperature conditions, they maintain normal function and support the hormonal production necessary for energy, sexual desire, and bodily balance. These habits, although seemingly small, form the foundation to prevent long-term problems, ensuring that vitality and reproductive capacity are preserved over time. Aggressive masturbation can cause tissue damage to the penis, resulting in irritation, bruising, and pain that interfere with sexual function. Excessive pressure, abrupt movements, or insufficient use of lubricant can affect the elasticity of the skin and blood vessels, generating microinjuries that accumulate over time and cause recurring discomfort. These habits not only affect physical health, but can also reduce sensitivity and alter the ability to experience pleasure, significantly impacting sexual life. It is important to recognize that the penis requires specific care to maintain optimal function. Using gentler techniques, applying appropriate lubricants, and respecting rest periods allows the skin and tissues to regenerate properly. Understanding how the body works and which movements are safe helps avoid injuries, improve erection quality, and ensure that masturbation becomes part of a healthy and satisfying experience without long-term negative consequences. Adopting safe techniques during masturbation and maintaining natural penile stimulation helps preserve the health of the organ and prevents long-term damage. Using appropriate lubricants reduces excessive friction and protects the skin and internal tissues, while paying attention to bodily sensitivity allows the experience to be enjoyed without risks. This conscious practice also helps maintain optimal blood circulation, supporting firmer and more pleasurable erections and preventing discomfort that could affect sexual function over time. Incorporating routines of positive stimulation allows the penis to maintain its elasticity and responsiveness. Understanding one's own body and respecting rest periods prevents microinjuries and contributes to a more satisfying experience, while also reinforcing sexual confidence and overall well-being. Positive sexual education, based on respect for the body and safety, ensures that intimate activity becomes part of a healthy and balanced lifestyle. Lifestyle directly influences sexual health, and habits such as excessive alcohol consumption, smoking, and lack of physical activity can compromise erectile function and hormone production. Blood circulation is affected, limiting the flow needed for a full erection, while testosterone levels decrease, altering desire and sexual vitality. Adopting a prolonged sedentary lifestyle can also lead to overweight and cardiovascular problems, further worsening difficulties in sexual performance and intimate health. These habits, though seemingly normal and everyday, have a cumulative impact on sexual function and overall well-being. Becoming aware of their negative effects allows for gradual changes, such as incorporating regular exercise, moderating alcohol intake, avoiding tobacco, and maintaining a balanced diet. These adjustments help improve circulation, regulate hormone production, and promote healthier erections, ensuring that sexual life remains active and satisfying over time. Adopting a healthy lifestyle is essential to maintain sexual function and prevent future problems. Incorporating regular exercise helps improve blood circulation and tissue oxygenation, key elements for firm and lasting erections. In addition, a balanced diet rich in essential nutrients and antioxidants helps regulate hormone production and strengthens the cardiovascular system, directly affecting sexual performance and overall sexual health. Maintaining consistent routines and positive habits also improves daily energy and well-being, creating a solid foundation for intimate life. Small daily changes can have a significant impact on sexual function. Walking, playing sports, maintaining good posture, and controlling body weight are strategies that optimize circulation and reduce the risk of erectile dysfunction. Similarly, a diet that includes fruits, vegetables, high-quality proteins, and healthy fats supports hormonal balance and enhances vitality. Adopting these practices allows for an active and pleasurable sexual life while reinforcing personal confidence and overall well-being. Chronic stress and excessive self-criticism directly affect sexual health, generating physical and mental tension that makes the relaxation needed for a full and satisfying erection difficult. Anxiety about performance or constant worry about appearance and capability can cause temporary blockages or a decrease in sexual desire, affecting self-esteem and the relationship with the partner. Recognizing the mind-body connection allows one to understand how emotional states influence sexual function and how to manage these emotions effectively. Maintaining emotional and mental balance favors sexual response and overall satisfaction. Practicing relaxation techniques, mindful breathing, and daily moments of disconnection help reduce accumulated tension and improve focus on pleasurable sensations. Learning to accept personal limits and manage internal pressure allows sex to be enjoyed with greater calm and confidence, generating more satisfying experiences and promoting a positive cycle of physical and emotional well-being. Adopting a healthy lifestyle is essential for maintaining sexual health over time. Incorporating regular exercise, a balanced diet, and routines that favor blood circulation helps maintain optimal energy and hormone levels, including testosterone, resulting in firmer and more consistent erections. Activities such as walking, swimming, or playing sports consistently not only benefit the body in general, but also strengthen the systems that support sexual function and genital vitality. Additionally, caring for sexual health involves paying attention to daily habits that may seem harmless, but affect circulation and erectile strength, such as prolonged sedentary behavior, excessive alcohol consumption, or smoking. Maintaining regular routines, combining rest and physical activity, creates a favorable internal environment for sexual function. These healthy habits contribute to overall well-being and help prevent future problems, ensuring that sexual life remains active, satisfying, and long-lasting. Chronic stress and excessive self-pressure can have a direct impact on sexual health. Anxiety about performance or constant concern about sexual function can cause difficulties in erectile response and reduced desire, affecting the relationship with one's own sexuality. The body and mind are closely connected, and high stress levels alter circulation and the release of essential hormones, generating a negative effect on energy and sexual sensitivity. Recognizing signs of tension, such as difficulty relaxing, obsessive thoughts about performance, or physical discomfort related to anxiety, is key to acting in time. When the mind-body connection is neglected, consequences can accumulate, creating a cycle of frustration and reduced satisfaction. Maintaining active awareness of your emotions and how they affect sexual function is the first step to preventing problems and maintaining a full and harmonious sexual life. Caring for mental health is essential to preserve sexual life and overall well-being. Strategies such as practicing mindfulness, relaxation techniques, and moments of introspection help reduce stress and anxiety, facilitating a more natural and satisfying sexual response. Recognizing your own emotions and accepting your limitations allows you to enjoy sexuality with less pressure and more pleasure, strengthening the relationship with your own body. Additionally, balancing the mind with healthy habits, such as dedicating time to activities that generate satisfaction and well-being, promotes the release of hormones that enhance sexual vitality and motivation. Maintaining a positive connection between mind and body creates an internal environment that favors sexual energy, confidence, and satisfaction in intimate relationships. This holistic care ensures that sexuality is experienced naturally, reducing blockages and increasing the quality of pleasure. Lack of penile stimulation can have significant long-term consequences, including partial tissue atrophy, loss of sensitivity, and decreased firmness in erections. The absence of sexual activity or regular stimuli can weaken circulation and affect tissue elasticity, generating changes that impact both physical function and personal confidence. Although these effects may develop gradually, their repercussions are significant and affect sexual quality of life. Ignoring the need to keep the penis active causes a disconnection between mind and body, compromising desire and sexual response. Fictional examples show that resuming adequate stimulation allows functionality to be recovered, provided it is done progressively and consistently. Understanding the importance of regular stimulation and respecting the signals of your own body is crucial to prevent atrophy and maintain a healthy, satisfying, and long-lasting sexual life. Maintaining regular sexual stimulation is essential to preserve penile health and erectile function in the long term. Frequent sexual activity, whether through intimate relations or controlled masturbation, helps maintain tissue elasticity, circulation, and sensitivity, preventing atrophy and loss of firmness. Even the practice of alternative stimuli, such as toning exercises and massages, can be helpful in ensuring that the organ remains active and healthy. Regular stimulation also strengthens the mind-body connection, increasing confidence and reducing anxiety related to sexual performance. Creating routines that incorporate moments of attention to your own sexuality without pressure or guilt allows vitality to be maintained and supports a more satisfying sexual life. Consistency in stimulation ensures that negative changes associated with inactivity are prevented and that sexual health remains optimal over time. In summary, avoiding the 10 most common mistakes related to sexual health is key to maintaining a full and satisfying intimate life. Prevention, careful observation of bodily signs, proper hygiene, protection during sex, testicular care, regular stimulation, moderation in harmful habits, stress management, and adoption of a healthy lifestyle form a set of fundamental strategies to ensure sexual well-being. Being aware of these practices allows sexuality to be experienced more consciously and safely. The final message is clear. Sexual health is not a luxury, but an essential part of overall well-being. Maintaining correct habits, listening to your body, and cultivating a positive relationship with your sexuality ensures that satisfying sexual relationships and an active intimate life can be enjoyed for many years. Consistency, attention, and prevention are the keys to transforming sexuality into a source of health, confidence, and lasting well-being.